Depression is a medical illness, right? It's not something that happens to us just because I had a bad news or just because something happened in my life. We people with depression and depressive illnesses have a genetic vulnerability to it, just like diabetes or blood pressure or thyroid or cancer. Even if I have a genetic vulnerability, so what happens is if there's a trigger, it could be an external trigger like a stress, which could be like a sudden stress, or it could be like chronic stress. It could be, oh, I failed, or it could be that, oh, there's constant fights in my house, or it could be, displacement that, oh, my house got raised and I have to move somewhere else now and start all over again. A lot of these external triggers, those could be life events, right? But there are also internal triggers. I could have hypothyroid. I could have another illness, be taking some medications that may trigger my depression. So it's a medical disorder. Now, this medical disorder impacts all of us, all of our body. It impacts our behavior. Definitely, it impacts our emotions. It impacts our thought process, and it also impacts our cognition. Cognition is something like memory and attention span, and ability to solve problems, creative learning. Thoughts are, oh, I'm hopeless and I'm helpless, and this entire thing is worthless, and it's not like a very good life, and maybe even like suicidal ideas, life is not worth living, or I'm fed up of this and I should do something and harm myself or kill myself. The emotional symptoms could be low mood, sadness, crying, irritability, just not feeling, just not being able to feel happy. Even if something good is happening, one cannot possibly feel that depth of emotions, something good or bad for that matter. It's a behavior issue, a symptom where I might not feel like getting out of bed, and even getting up to take a glass of water for myself could be very, very difficult for me to do. I'll isolate myself. There might be fights in my house with interpersonal relationships, or problems at workspace, whether that's at school, college, or other work, whether that's my household activities or my external activities. So it impacts all of this, right? So that's why there's kind of like a low quality of life, but also there's a deterioration of my functionality. So when we're looking at depression, we are looking at symptoms, but also on a day-to-day life functionality. And because it's a medical disorder, it's important for us to understand that to say things like, oh, but your life is so good, why are you depressed, is something that's very offensive. Because yes, my life is good. I mean, it's not perfect. Nobody's life is perfect. But because my life is good doesn't mean that I can't have an illness. And doesn't mean that you should then kind of like gaslight me saying that, oh, it might not have happened to you at all. So that's something that we definitely need to understand. It's a disorder that can happen to anybody. It may or may not require a trigger. I may not have anything and I could still have these symptoms, or I could have these symptoms because they just kind of like happen also in response to constant or chronic or acute stress in my life. So that's something that we definitely want to be more aware of, so that we can help ourselves and the people around us that we care and love about. A lot of the times we get asked, what's clinical depression? Or sometimes people, start using these words that, oh yeah, I was very depressed last week. So it's important for us to understand that, okay, it's okay for us to say things like, I was feeling very low and very sad last week because this happened or that happened, or I don't know, I had PMS. So that's a different kind of depression. That's a different kind of feeling that we're talking about. But when we're talking about clinical depression as a medical disorder, we need to understand that I may have these symptoms like mood and thought and behavior and cognition. And these symptoms would last, they would persist. They would last for 2 weeks or more, and probably 5 days or out of 7 days. And no matter what you're trying to do, there's somehow not being able to kind of like get better, or it's not like, you're not being able to manage these symptoms. So when we're looking at a persistent few weeks of change in your patterns, that's when we will definitely diagnose you with a disorder if you have one. If you see somebody that, your loved one or somebody you care for, or somebody that, you're working with or teaching maybe even, and if you notice that there is a change in their patterns, change in patterns of sleep, change in patterns of eating or weight gain, weight loss, a change in pattern of like even facial, expressions, They might not smile the same way, or they might like just look tired, or they might just look lost, or there are changes in, like, there could be mood swings that they're fine and all of a sudden they'll just kind of like get very annoyed for a simple thing that usually doesn't annoy them. So when you see all of these changes and they're lasting for a few days, then you definitely want to consider that, okay, there may be a illness and a disorder, and it's very important for us to go and get just diagnosis. Very often we get asked, why does this happen, right? Why does this illness happen? Like, we understand that, okay, if I wasn't wearing a mask and I'm around people who are infected by COVID, then I might be COVID positive. Yes, so this is not a germ based or a virus based infection, but this is a disorder of my body which connects all parts of my body, right? Because my brain is kind of like responsible for a whole lot of functions of my body, and it sends signals and it receives signals. So that's why when we say that depression impacts everything, it impacts everything in your body. Why does it happen? As stated earlier, and I'm sure you've heard about it a lot as well, that there's a dysfunctionality in the brain, right? We know that most of 50% of the people who have a psychiatric illness have had these symptoms or diagnosed by age 14, and 75% by age 25. So we do know that the brain develops till age 25 at least. And during these developmental periods, there are changes that are going to happen internally in your body as well as externally in your life. And these kind of changes may set off a disorder which impacts your brain in a way that the structure of the brain, the chemistry of your brain is different. I'm sure a lot of us have heard of neurotransmitters like serotonin and dopamine and norepinephrine. So when the balance of that is like a little off, I don't have the neurotransmitters where I need it. I have them, but they're not where they are. Those are the reasons and causes for the illness. The symptoms of those could be different, right? The symptoms of those could be that, okay, I have less patience now, so I'm going to fight with my husband. So that doesn't mean that, oh, because I'm fighting with my husband, I have depression. It could actually be that, oh, I have an illness called depression, and that's why I'm not being able to manage my emotions very well, and I'm having fights, and I'm misunderstanding so many kind of like social cue. So, we say that something like cognitive distortion. If somebody's smiling at me, I would, instead of like being able to read the smile, that, oh, this person is smiling at me politely, or this person is smiling at me because they're happy to see me, I may misconstrue it, oh, they're smirking at me, or oh, they're laughing at me, or oh, yeah, they really don't want me around. So my ability to kind of understand these social cues are also impacted, which is again, like I said, a function of my brain, which is also kind of connected to my body. A lot of the times there's a gut brain axis. So if I have like a digestive issue that can also trigger my depression. So it's an inflammatory process. That's why we say that, when people have COVID or they have other kind of viral infections, that will offset depressive illnesses and anxiety illnesses. So a lot of these kind of biological changes that are happening, whether they're developmental, whether they're infectious, whether they're metabolic, they will definitely trigger those dysfunctions in my brain, because of which I have an illness. And like I said earlier, that it doesn't discriminate. So it can happen to a young child, it can happen to an adult, fully functional, productive adult, and it can also happen in old age. And contrary to popular belief that, oh, kids can't have depression or older people will have depression, that's not true at all. An illness is an illness, and it's not something that has to happen or cannot happen. So we definitely want to keep our kind of like biases that we may have formed over a period of time because we've seen something in movies or television or read something. And we definitely want to have our medical advice from medical professionals who are trained, and not just like a WhatsApp university. When we are talking about mental health, mental well-being, and mental health issues and mental health disorders, we are talking about improving mental health literacy. I'm talking to you today with that aim, that hopefully our mental health literacy is improved. So that means we understand what mental health is. We understand what good mental health practices are. We also understand what symptoms may be so that we recognize it. We also understand if we have symptoms, what do I do with them? We also know that, okay, what are the resources that are available for me? If I do suspect that I have a mental health condition or a disorder, Who do I go to? So improving your mental health literacy is very important for all of us, age no bar, region no bar. When you do feel that you may have an issue, reach out to somebody that is aware of these illnesses. That could be your local general physician, that could be a school counselor or a campus counselor, that could be a mental health professional that's been provided to you by your corporate, or that could be your friendly neighborhood psychiatrist. You can also go to a clinical psychologist who's qualified to diagnose it. Counseling psychologists are not qualified to diagnose a psychiatric illness, and the only people who can diagnose are medical doctors and psychiatrists and clinical psychologists. So if you go and kind of meet them, and they'll take a detailed history in terms of what's happening, since when it's happening. Doctor might even run some tests. They want to rule out that you may have a thyroid condition, or you may have other kind of illnesses like hypertension or something else that's been going on, and that's getting masked by these kind of symptoms. So we will also run some tests, and that's when we will kind of like say that yes, definitely you fall into this category, and you may have a depressive illness of whatever kind. And they'll also tell you about your prognosis in terms of how quickly they expect you to feel better, in what sense, and all of that, and what to do. So it's important for us to reach out to people that we know are capable of doing this. So the qualifications of the person also matter. Very often, children go to pediatricians. Pediatricians know how to look for these symptoms as well. It's very important for you to mention these symptoms, because you wouldn't know what's important and what's not important. So go ahead and tell your doctor everything. Let them sort it out, okay, what they need, what kind of information they need. A lot of the times women go to the gynecologists. I hope every woman goes to a gynecologist at least once a year, and not just when she's expecting a baby. A lot of the times you can ask your gynecologist that question, because, when we go to one doctor, we'll say that, oh, doctor, I've come to you for cough and cold. But you know what? I think my eye number has also a kind of, I don't really see the blackboard very nicely. So the doctor is going to send you to an ophthalmologist. So in a similar manner, when you go to a general physician, you can also ask for directions for a clinical psychiatrist, or maybe even a clinical psychologist, depending on how bad or how prolonged your symptoms are. When we talk about management, right? Management means accurate diagnosis and a treatment plan. So when somebody comes to us, we're definitely going to see what their symptoms are. We take a history. Do they have a family history? Do they have a past history? What kind of stresses may or may not be going on in their lives? We also definitely ask medical history. Do they have thyroidism or Parkinsonism or something else or the other? What kind of medications they're on? So all of this information is important for us to not just diagnose, but also plan a treatment plan. That's the reason we say it's called management, right? Once the accurate diagnosis has been reached, like I said earlier as well, we might also run some blood tests, as well as, depending on other symptoms that you may have, an ECG or an EEG or an MRI brain scan and other routine investigations. We could also occasionally do a psychological evaluation for your personality type and maybe your emotional struggles right now. Though those are not really required, but they come in quite handy when we are doing therapy sessions as well. And it's important, and it's a good tool for getting more insights. We may also do some scales where we are trying to see what level your depression may be, a mild, moderate, severe. So that helps you also to figure out that, okay, where are you at what stage of the disorder, and how it's going up and down, or maybe like that. This is how we diagnose. Once we do diagnose, we definitely want to let you know what the diagnosis is. We don't just kind of like say, okay, yeah, just take this medicine and go. We will definitely want to psychoeducate you what the diagnosis is, what the illness might be. Hopefully, there are family members or other social support that's involved, and we'll talk to them as well. A lot of the times when it is a mild depressive case, which is not a very long duration, we will only try therapy and some amount of counseling. Of course, there's a difference between counseling and therapy that we need to understand. Counseling is basic advice giving that a whole lot of us can just give each other as well, especially if we are qualified in that particular area. And therapy is a structured approach which is evidence-based. Not everybody is qualified to be a therapist. but everybody can kind of like, learn skills of counseling. So you want to definitely make sure that if you are taking counseling, or are you taking therapy, and what kind of therapy. Is it cognitive behavior therapy? Is it rational emotive behavior therapy, CBT, REBT? These therapies need to be evidence based. Because if there is no evidence based therapy and you could be going for some kind of other counseling, the outcome may or may not match your expectations. We definitely know that if there is a depression between mild and moderate, or moderate and severe, the combination of medications and therapy gives you the best outcome. When we are talking about preventing depression, so that's really good news for me, because as a doctor we will always tell you prevention is better than cure. So how do we go about this? Is it even possible for something like depression that we can do prevention? We can definitely, and we do need to kind of work on that a lot. That's the reason that mental health, the entire spectrum, from focusing on illness, it is also shifting to wellness. Because when we are talking about mental health wellness, then there are better chances of you not to land up at the other spectrum of illness. Also, when we know, we have so much of information now available to us. So if we know that, okay, it has to start from before my birth. If I know as a woman or as a man that, okay, I have a psychiatric illness, or that I have a family history of psychiatric illness, so I'm going to see to it that when I'm planning a baby, whether I'm a man or a woman, doesn't matter. When I'm planning a baby, I'm going to have all the right kind of information that I need, how to take care of myself physically, also how to take care of myself mentally, how to be supportive of each other. I still need to take care of my mental health as well, because that's going to impact the mother's mental health, which is going to impact the infant and the child, the child in the womb, and when the child is born as well. So it has to start from there. So understanding what are good mental health exercises, understanding how to take those short breaks, how to recognize symptoms, and how to help yourself do better emotional management, whether that's anger, whether that's sadness, whether that's anxiety, living a healthy lifestyle as much as possible, doing activities that are stimulating and that are good for your brain, enjoying yourself, taking some time out for yourself. So this is that's kind of like in a larger aspect. But when we actually boil down to like a physical thing, okay, what do I do today? So I'm going to see to it that I'm sleeping adequately. I'm going to see to it that I'm eating my balanced meals at regular hours. I'm going to see to it that I get physical activity. I'm going to see to it that I work. When I'm working, I'm doing one thing at a time and not just also checking Facebook or scrolling on Insta, so that I can just focus on work, be productive, finish it off in time, and then maybe to spend some time on social media, so that by the time I go home, I'm still fresh and happy. And I'm happy to see that my child's running to hug me, instead of like, give me 5 minutes to rest at least. So that's what I'm going to do on a daily basis. I'm going to see to it that I take time for myself, even if it's those 10 minutes of just sitting, humming my favorite tune, or just drawing something maybe, or just kind of like looking outside my window and looking at a pretty flower, or something. So taking that a little bit time for yourself, because a lot of time people get scared of just being by themselves. What am I going to do for 10 minutes by myself? So all of these things on a daily basis, when you start doing, that's going to reinforce your mental health, and it's going to improve your resilience. And this is very achievable. So we also want to emphasize that when we talk about self-care, it's not just about that, oh, I'm just going to not do anything at all and just sit in bed. Self-care will look different for different people at different times, but we do need to prioritize all of this. So when I'm saying that, okay, this is what you need to do, it sounds kind of simple, isn't it? Because this is what we are taught even in school. Okay, this is how you're supposed to live. So actually, when you look at it, taking care of my mental health is not something new that I need to learn. It's just something to reinforce what I've already learned in my daily life, which is very doable. And we definitely want, a lifestyle to be something that's sustainable over a long period of time, which is not very difficult to achieve. And if everybody else around us are also kind of like of a similar bent, similar mind, then it's easy for us to kind of, go ahead and have a healthier self and a healthier environment as well. So best of luck with that. And like I said, it is totally achievable. Don't let anybody tell you otherwise.